still looks pretty bad.
It's really bad.
It is 5 months since we were last here, a place of such remarkable and stark hopelessness still.
People out here are lost, man. People out here are hurting, man. Like, people out here come from broken homes. People out here really don't have a reason to live anymore. Like, they're here to die.
Back in February, we thought these streets represented something new. An emerging drug cocktail, Tranq, was causing horrific wounds. Certainly the medics here were shocked by what they were seeing, and the city's health officials said they feared a nationwide spread. But it turns out it's already firmly established across America's drug market. The White House has now accepted that Tranq, or Xylazine, represents what they call a grave threat to the nation, and they're not wrong. For you, this was something that began with painkillers, prescribed, then self-medicated, and it went from there.
Yeah. Continued and from there. I really didn't have any place taking me seriously.
Christoph is injecting as he talks.
There's this young guy.
It takes just seconds.
And then it was just like, what am I gonna do? You know?
He drifts off. Sorry, we'll leave you sit to have a seat.
Yeah.
New analysis of data stretching back to 2019 shows a jump in xylazine-related deaths of 276%. It has now been detected in 48 of the 50 US states. The government's national plan involves access to prevention, harm reduction treatment and recovery support, as well as bold actions to disrupt the supply.
Have you seen any sort of change in state or federal help over the past few months?
No.
As before, our guide through all this is volunteer Ronnie Kaiser.
I'm glad they're finally implementing something. I just hope that the implementation is fast enough and it's the correct one. Most have either mental health or trauma that's been in their life.
Well, there is no question for me that things are starkly worse now than they were just a few months ago. Everyone here seems to welcome the White House plan, but honestly, the challenges, the complexities are so huge. And now we know that increasingly it is replicated nationwide. From these streets to the White House and those who must solve all this. On the streets here, it looks like failure. It looks like you have not remotely got a grip of the crisis here in Philadelphia and across the country.
I think what you're seeing and what I have seen on the streets of Philadelphia, specifically on Kensington Avenue, is an example of what does happen when we are not implementing those policies first and foremost. The policy change that has occurred with prioritizing harm reduction, prioritizing treatment, meeting people where they are, is working.
Christoph was back with us within just a few minutes. The hits are intense, but short, and of course highly addictive. Mark Stone, Sky News in Philadelphia.